Welcome back for the Broads on Sirius XM Stars Channel 107. Hey, coming up, we still have Joshua Ledette, one of the Idol kickoffs. We have Dave Hill. He wrote a book, a series of essays. And also, CBS Money Watch's Jill Schlesinger. We're going to talk about money and making money in the stock market 101. All right, joining us now is Dr. Adam Schaffner. There's a new trend, okay? It's called FaceTime facelift. People are flocking to their plastic surgeons because they're seeing themselves in like Skype, video chatting, all this stuff. And they're looking at themselves and they're going, oh my God, I look terrible. I got to do something about this. So they go into the doctor's office and they use the technology as the template saying, I look like crap on my iPad. Can you fix this? Mm-hmm. So apparently this is a new trend. So we have a doctor joining us, Dr. Adam Schaffner, and he's going to tell us what this is all about. Dr. Adam Schaffner, welcome to BROADMINDED.
Thank you very much. Great to be with you.
All right, so let's talk about this trend. Why are people coming to you based on technology? Is this true?
It's absolutely true, and I think one of the things that people have not done as much in the past as they are now is seeing images of themselves. Everyone used to take photographs and they'd see the way they look, but now they're seeing a virtual photograph of themselves every day, whether it's on their Facebook account, whether they're on Skype or any other social media, and they may see things that they wish weren't there. They may notice signs of aging more so than they noticed them in the past, and they want to be proactive and address them so that they're happy and confident about the way they look.
Okay, can we just stop for a second and talk about Skype? Nobody looks good on Skype. You are distorted. It isn't what you really look like. Do you tell your patients that?
Absolutely.
Okay,
I will obviously go ahead and say that a digital image is never going to be as good as the real thing, but we'll go ahead and sit down together and look in the mirror and address what their concerns are, and based on what the concerns are, I'll offer suggestions as to how we can best achieve the goals of the patient.
So I think you're right, Dr. Schaffner, that people are seeing more of themselves based on technology. I mean, before digital cameras, we had regular film. Now we can see ourselves 24/7 right back at ourselves. So now we're just seeing more of ourselves. So that in itself is going to promote this image issue.
I completely agree, and I think that is one of the driving forces behind the phenomenon.
So I believe in this phenomenon because I think when I see myself, I have to admit, I do this all the time, and I could show you guys.
Yes.
My iPhone. The new iPhone has a flip camera. So what you can do is you can push it and you can face it toward yourself.
I like that picture of you, actually.
So I sit there in my car when I'm waiting, and I start looking at different angles.
But the one you chose
I don't like what I see.
Looks good. The one on your Facebook, I think it's on your Twitter, too, looks really good, Molly. It's black and white. It's good angle.
So basically, what I've done, Dr. Schaffner, is I find myself playing with this camera. Then I see myself. I take a picture of myself. Now I'm really looking at myself. I end up taking 10 pictures, different angles, and then I pick apart and say, oh my God, there's my chin. What happened to that? Look at the shape of my head. And I get body dysmorphic disorder. Is that what it's called?
Well, people can have body dysmorphic disorder, but what you're describing is a far cry from body dysmorphic disorder. It's, I think, people really appreciating the various views that they can see of themselves using this new technology, and then pointing out certain concerns that they have. Somebody with body dysmorphic disorder, which is a psychiatric diagnosis, has significant issues with the appearance of their body, and sometimes with things that aren't actually there.
I was going to say
those problems that have been addressed and don't know when to say enough's enough.
Yeah, those are people that see things that literally
I'm
don't
exaggerating,
exist.
but essentially what I'm doing is I'm starting to pick apart my face, and I'm starting to analyze, and I'm starting to. So then I got to go to the doctor. I got to get. So what are people? How do you fix people? I don't like the word fix. That's really a stupid word. How do you help people look better?
Well, I think awareness is the first thing. And once people are aware of themselves, the way they look, and the concerns that they have, the next step then is to identify whether or not those concerns are
real.
Potentially something that can be addressed through an aesthetic procedure, or whether or not that's something that is not going to really be able to be addressed by an aesthetic procedure. Most of the time, these things can be addressed, and the common concerns that people have are fine lines that are on their face, sunspots, jowls, what we call the nasolabial folds, or those lines that are there in between the corners of the nose and the corner of the mouth. Sometimes it's a turkey waddle or some laxity in the midline neck. Sometimes it's bands in the neck. The list goes on and on. But I think really what it needs to be is starting with a discussion with an appropriate plastic surgeon, facial plastic surgeon, who can really sit down and analyze the potential causes and then offer treatment plans that may help the patient.
Okay, so Dr. Schaffner, if I came in to you and I said, listen, I just saw myself because I did, this was the worst thing ever, CNN via Skype with my bad drapes in the background, and you watched it with me, and I said, these are my concerns. How do you I would think you would want to steer me away from any kind of serious surgery and maybe, kind of fillers or Botox or something like that. Do you try to do that for people?
Well, it's really something that has to be tailored to the individual's needs. Some people, if they're coming in their 60s and 70s and have significantly advanced laxity, fillers may not alone address their concerns, and sometimes surgery is necessary. But the vast majority of the time, surgery is not necessary to address a patient's concerns. And to address your first comment, while it's always great to see the way people view themselves on Skype, I think it's even more important to examine somebody in person and to have the discussion based on the way he or she looks in person.
But do you ever watch it with them?
Imaging that we see on all the social media may provide the really the impetus for people to take action. I think the real important thing is not to make decisions based on those images, but rather make decisions based on an examination together with that doctor.
But do you watch, like, if I came in there and I said, will you watch this with me? Would you watch it? Do you watch
absolutely.
it? Yeah,
I
would
people
think.
People come in all the time with their iPhones, their iPads, and say, look at the way I look here on this video, on this photo, on this profile, and I absolutely will take a look at it, acknowledge it, and then try to segue from what that problem is that they're seeing in a digital image to what the issue is in real life.
Yeah.
Doctor, I don't know what happened to my face in the last 20 years, but I think my head shape has changed.
Molly,
I'm serious. I think something's happened to my actual skull.
I
think we might have to do skull work.
There's
nothing.
No, something. If you look at these pictures on my iPhone, it's horrible.
Reality, there have been studies done based on CAT scans where they've analyzed the skull and the associated bony structures of the face.
Real.
And have noted that there are definite changes that occur in all people as they age, and it's not just changes with the soft tissue, but it's also changes with the bone as well.
So I'm not imagining this. I am becoming Cro-Magnon.
Oh, my God.
Probably not that much, but some subtle changes you may notice.
All right, I'm being somewhat,
That's
funny,
interesting,
I guess.
though.
But I do want to say that there is, so to be clear, a FaceTime facelift, it's no different than just going in to your plastic surgeon or your dermatologist and saying, hey, I'd like to look better. I don't like the folds around my face. I don't like these wrinkles. It's just because of technology, it's bringing people to the office for those reasons, as if they didn't have the technology, but essentially it's the same aging process.
It's the same aging process.
Yes.
We all age with or without social media, and social media is just allowing people to see themselves more often and really providing the motivation for them to take action. And whether it is a facelift or Botox or fillers or lasers or a whole host of other things that we have at our disposal to help people, it's something where that plan will be developed on which things to do or not to do based on the patient's desires and the consultation with the doctor.
Okay, here's something I've noticed. Is it true that your nose and your ears continue to get bigger with age as you...
You have some soft tissue structures in the nose that can become more lax and elongate with age, and so it's not that your nose is
getting bigger,
growing per se, but because those tissues become more relaxed, it does tend to change shape and can elongate.
What can you do for that? You have to have surgery for something like that, right?
Well, some people will choose to have an adult rhinoplasty or an adult nose job to help address that, to help lift that tip and to restore some of the profile that was there when they were younger.
I just want it chopped off, like the end.
Now, what about a neckline, a good, strong. I think that everybody, if you look at people in Hollywood, they don't have to be beautiful, but you know why they look so good on camera? Because they all have great chin lines, necklines. What can you do? Is there anything you can do besides actually cutting and pulling?
Well, jawlines and necklines are something that provide an appearance of youthfulness. A strong jawline and chin is a symbol of strength. If you look at not only actors and actresses who have chiseled jawlines, but many heads of corporations, heads of state have strong chins. And having a strong bony structure along the chin line can also serve to help support the neck so that you don't get the turkey waddle as early in life as others may. So to answer your question, it is possible to do certain things without surgery to help strengthen the jawline. For example, if someone gets jowls, you can camouflage those with filler materials. You may have heard of things like Juvederm or Restylane or
We've had Juvederm.
And you can use those to help camouflage the jowl so you don't have to have a lift of that tissue that's fallen with age.
Mm-hmm. Well, we appreciate you coming on the show, Dr. Schaffner. And all this information is on our Facebook. So if you go to Broad-Minded Broads and like us, you can check out Dr. Adam Schaffner and his practice. We appreciate you coming on, and we'll talk to you in the future.
Look forward to it. Thank you very much.
Thank
all
you.
Right. Well,
and we'll see him the next
really,
time we're in New
it's
York.
just, it makes sense. People are seeing more of themselves through technology. And I forgot. I've sat there in the car. I'll never forget George Mason University. You should see all the pictures I have on my phone. I won't show anybody. I look horrible.
What do you mean at George Mason?
I was
You didn't have phones.
there.
Oh.
No, this was for.
I was going to say.
No, I was there.
On your box phone?
No, I'm talking about just
Yeah.
being in the parking lot waiting for something. I think I was going to see Carol Lee Campbell's play. And I have all these pictures, and I thought, oh, my God, I got to stop this. All right, coming up, we got Joshua Ledette from American Idol. He got kicked off, and we're going to talk to him next. You're not going to believe what he said behind Philip Phillips' back. We'll be right back. We're the Broads on Sirius XM Stars Channel 107. Ooh. And I thought they were friends.